So I'm a board certified psychiatrist and have helped over 160 PMHNPs gain clinical confidence in their psychiatric diagnostic skills, treatment skills, medication skills, supplement skills, and helping their patients actually get better. So in this video, we're going to be covering how to build rapport with psychiatric patients and the things I do to make sure me and my patients have a strong connection. We know from therapy literature that the number one thing that separates a patient getting better from therapy is not the type of therapy, it's the strength of the therapeutic alliance, meaning how strong the relationship is between the provider, between the therapist, and the patient. So it's the same thing with psychiatry. For us, the things that we discuss with our patients are very sensitive. And so the relationship we have is much more important than, say, that the surgeon has with their patient. That's why notoriously, right, there's a stereotype about the personality of a surgeon versus a psychiatrist, because their bedside manner does not impact the quality of their surgical skill. Whereas for us, the words that we say, our behavior, our body language, it's almost like we're performing verbal social surgery, and the way we act and perform matters to the patient outcome. I'll walk you through the whole process that I go through that really helps me develop an outstanding rapport with the patient from start to finish. So the first thing that I do is that I make sure that the intake paperwork, so this is for my private practice, but make sure that the intake paperwork is thorough. I've had so many patients tell me that, wow, this is more paperwork than I've ever done with any other psychiatrist. And so this is because I want to gather as much information as I can about them. So that way I already know them, or I know quite a bit by the time I go in. So I do diagnostic scales for all the different treatment conditions, especially what they tell me. So like I'll do, if they like say coming for anxiety, depression, so I'll do anxiety scales, depression scales, I'll assess for ADHD, I'll assess for trauma. All of this is before the appointment. But because I do this, then I come in with a level of professionalism, and they say, wow, like you covered stuff here I never thought would be on here, or I never thought of even saying. So that way they're already pre-framed into the interaction, viewing you as a professional. So then after that, what I do, so at the start of an interaction, is I will let them talk. In the course of a standard psychiatric interview, there you have let's say 60 minutes, and you're trying to gather all this diagnostic information. You're trying to put it all together so that way you can come up with your treatment formulation and then come up with your treatment plan all in 60 minutes. So for me, I actually spend 90 minutes. So longer patient appointments. So I do 90 minutes. And I found that that really helps me get to the bottom of things, but as well as really like explore things with the patient in deeper, and even go into some like personal things as well too. So by letting them talk, this is, their chance, everything they want to get off their chest, they can kind of get off their chest. Whereas in a standard psych interview, especially if a patient rambles, then you have to be able to cut them off and you have to be able to redirect them very quickly. But they want to talk though. So I give them that opportunity, especially for the first 5 minutes, uninterrupted. Well, I'll just let them do that. I will also ask about interests and align myself with that, if I authentically can. So for example, I see a lot of kids, teens, adolescents. So I'm a gamer, I like games. And so when I was having an in-person office, I had all of my video games, like all my PlayStation games, all my Nintendo Switch games. I had them all in my office, actually. I had anime posters of the animes that I like plastered in my office. And so when a patient would come in, like, obviously not every patient's going to be into it, but the patients that were, they would see it and be like, oh, like, like that's cool. Like, oh, like this guy's a One Piece fan. Or I've had kids like go through my games and be like, oh, you like this game or that game. And so immediately that aligns me with the patient. And then remembering those interests too. For example, I have a patient who told me that he got a Nintendo Switch and he was taking a big test, so he couldn't play it. So after the big test, I asked him if he played the Switch, and he was like, oh yeah, like, you remember that I got the Switch too. So, remembering things like that can make a huge impact in building rapport with the patient. obviously you shouldn't lie. So if a patient's into, like, for example, drama and theater, I'm not going to act like I'm into that stuff, but I can ask them questions about it and show interest. This is what makes them human. They're not just a collection of psychiatric symptoms that you target with the medication. They are a person wanting to get better and suffering with these things. So you treat them like a person. By treating them like a person, they're going to remember you and build a much stronger rapport and connection with you than otherwise. And this makes a difference. So, for example, when I was at my old practice where I was employed and then I went to full-time private practice by myself, patients called me, they followed me, and they said, hey, no, I don't want to be assigned to a new doctor. I want to work with you. So that's a sign of the rapport that I'd built with the patient, because now they want to work with me. Like one of the patients, he was a 17, 18-year-old kid, and he likes weightlifting, and I like weightlifting. So we would talk about his lifting regimen and what he worked out that day and what his diet was like, whether he was taking creatine. And so because of that, he came and followed me to my own practice afterward, even though I was charging higher prices, and he was willing to pay for that. So there's that. The next thing that I like to do is, let's say I'm going through a treatment plan. I like to present the patient with options. So what this means in practice is, a question I'll ask patients is, okay, so I have some patients who want medication treatment. I have some patients who want therapy. I have some patients who want more supplements. I have some patients who want more like the holistic. I have some patients who kind of want everything. So what is it that you are looking for? So when I ask this question, I think that creates a lot of trust between me and them, because what they're used to is a more paternalistic approach, whereas I'm providing more of a team-based approach. Like, we're working together to solve this problem, as opposed to I'm the doctor, I'm telling you that this is what's going to be the solution. So it's a different type of mentality. So you don't want that. You want the team-based approach. And so by providing the patient with options, you have that attitude is, we're working together. That's the attitude that you should have when you're working with the patient. So I like to present them with options for their treatment, and I think that creates a lot of trust. Next thing I do is explain treatment plan thoroughly. So for me, now that I work online, like I will literally create a Google Doc and I will go through step by step with them of the treatment plan. So since I do integrative, I'll cover, okay, here's the meds, the supplements, the therapy that we're going to be doing. Here's what we're addressing exercise-wise, diet, sleep, basically all the different components that we are addressing. Like, I'll lay it out on a Google Sheet and I'll share it with them. But this way, I make sure to spend a lot of time on this, like 30 minutes. Because ultimately, this is what they came here for. They didn't come here to just get, just to blab on about symptoms. They want a plan. They want your expertise. So that's why I make sure to spend a lot of time explaining the treatment plan thoroughly for them. So that way when they leave, they're like, okay, I have a fundamental understanding of what I need to do. A mistake that I've made in the past is I've actually done too much here. So like, I'll come up with this whole plan for them, and the patient will come back and be like, they didn't do any of it because they got overwhelmed. So now what I like to do is, focus on 1 to 2 key items each visit. I will outlay a lot of this stuff overall, because it gives them that long roadmap, and then say visit by visit, we can go into the specifics. Like the first visit, I want to focus on lab work and maybe a med change. The next visit, I'll start integrating some supplements in. Then we'll start integrating therapy in. And then over the course of that treatment, we start integrating exercise and diet and sleep, etc. So instead of giving them this whole laundry list, it's a whole plan that they can follow, or the general outlines of a plan, but they know that I have a roadmap in mind. So I have a plan for them. This is key, right? That there is a plan. So they trust you. They trust you because there's a plan. It's not like you're just kind of winging it. Then there's following through. It's hard to remember the little things. Like, for example, ordering labs, sending refills, getting letters done, like emotional support letters, disability letters, school diagnosis letters, things like that. But all those little things that come with being a provider, if you follow through on this stuff, that makes a huge difference, because a lot of people do not follow through on this stuff. So if they don't follow through on this stuff, then, if the patient has to remind you, like, hey, can you send that refill in? Hey, can you order the labs? Again, like insurance stuff, right? Like making sure that you submit their stuff for insurance payments. So for me, I'm out of network, but I will submit my patients for their out of network benefits. So following through on stuff, very, very important. I also, for me personally, I have a messaging portal. And so messaging, as a concierge psychiatrist, I can offer this premium level of service, but this allows me to really be able to stay up connected with my patients, check in on them. They can be able to reach me and message me when they want to through our portal. And so because of this messaging, right now they have a deeper level of connection to me than for other psychiatrists who barely are accessible. They see them once every 3 months and then they're gone, right, for 15 minutes. So I think this makes a huge difference, that you're actually an excellent provider. Like, you can do all of this stuff, but if you can't get the patient result, what they're paying you for, what they're seeing you for, then it's worthless and it's hopeless, because the whole goal is that you are trying to help the patient get better. And you can only do that, right, as much as you can. The better you are at medication choices, at supplement choices, the better you are at convincing the patient to do it. This is what makes you an excellent provider, is that if you have a good relationship with the patient, your patient's going to get better because they'll trust you and they'll follow you. So now, let's say they're thinking about changing their diet and they're like, oh, I don't want to. But if they like you and they have a good relationship, they'll be like, oh yeah, but Dr. Dewan said that I need to sleep 8 hours and I need to eat clean foods. Okay, so I'm going to do it because I like him and I trust him. Versus if I hate the doctor, then I'm not going to do that. Or, damn, I forgot my supplements on vacation. I really trust Dr. Dewan's expertise. I'm here for 2 weeks, so I'm going to buy the supplement here because I want to make sure I stick on it. That's the difference, and that's the level of investment you'll start getting from patients, as opposed to if you're not excellent, you're not able to build a good rapport with them, then they're not going to be nearly as successful. So it really, really does make a difference, and the more excellent you are, the better results you'll get for your patients, the more satisfied you'll feel with your job, because the more referrals you'll get, the longer patients will stick around. Everything gets better if you can actually deliver results for the patient. And if you want to learn how to do that, how I do this, and how you can do it better, then I would consider joining our Psych Academy. So it's a PMHNP coaching program for NPs, where I specifically teach things like this and how to become an outstanding psychiatric clinician. A lot of my students, for example, say that they never got this through the NP education pathway. And this is something I'm dedicated my life to. I want to teach you the same thing as well. So if that interests you, if you want to become an excellent, outstanding psychiatric clinician, I would join our NP Psych Coaching Academy. And yeah, I will see you in the next video.